block of respiratory system. Okay. So today we are starting with the experiments of GIT, yani abdomen. Okay. Today is the first experiment of GIT. Remember, these experiments, they are present in the toolbar, but if you want to download these experiments, you will have to go into the toolbar second semester, not the first semester. Okay, because let me complete. Because this GIT was previously a part of second semester. So this is the first time that GIT is a part of first semester. Okay? So if you want to download this experiment, please go to the second semester. In the second semester, you will go to the experiments. In the experiments, the first experiment you will find is this. The number is 1.1, but 1.1 not the first semester. Second semester 1.1. Okay? And in the toolbar you can see there are many types of documents present. Masalan, this is PDF. It is present in the toolbar. The doc is also present in the toolbar. PowerPoint presentation also present in the toolbar. So whatever you want to download, you can download. Okay? And the last page, as you know, is the report page. Okay? So today I will tell you how to solve the report page. There is no need of the report page because you don't have the experiment now. Okay? But you can download the experiment from the toolbar. Do you understand this?
Yes.
Okay? So today's experiment is a very important experiment as a doctor. As a doctor, very important experiment. The number is 1.1. If you see the object of today's experiment, you can see that it is the examination of abdominal viscera. Okay? Abdominal viscera of a human subject by doing inspection, palpation, auscultation, percussion. Okay? So, as you know that we have discussed the examination of cardiovascular system, we have discussed the examination of respiratory system. So this is the examination of the GIT, or we can call it examination of the abdomen. Remember, if you are sitting in the clinic and some patient comes to you with the problem and you think that the problem is related to the abdominal region, then you will start examining the abdomen. Okay? Why? To reach a diagnosis for the tashkhis of the disease. Okay? I have told you before that if you think that there are two systems or more than two systems involved, masalan abdomen also involves the respiratory system, masalan, so you have to see which one is more important, which one is more serious. Okay? So I suppose that in this patient it is the abdomen which is the problem. Okay? He has come to me with a complaint in the abdomen. He has told me that, doctor, I have severe pain in the abdomen. I was sitting in the clinic. Okay, Dawari, come to me, severe pain, Shadid, Alam. Okay, I asked him, where is this pain? Is it above the abdomen or below the abdomen. Okay? So he says that the pain is on the right lower side. Okay? So if I know the visceras, different types of viscera present in the abdomen, then many things can come in my mind. Okay? Then I have to confirm what problem he has. Masalan, he says that he has problem in the right lower region of the abdomen. Okay? Then many things come in my mind. In this part, there are kidneys. Also appendix. Also, there is a part of the GIT called as cecum. You know cecum?
Yeah.
There is colon here. You know colon? Ascending colon. Okay? So, and in female, there are ovaries here. Okay? So, this patient comes to me, he says that I have pain in the lower abdominal region. Many things come in my mind. So I asked him, just to confirm my diagnosis, I think he has the inflammation of appendix. Yani iltihab viscera. Okay? I think. Okay? But I am not sure. There can be many things. Then I will ask some questions. Okay? Do you know what is this called? Whenever there is inflammation of the appendix, called what? Appendicitis. Appendicitis. Itis yani iltihab. Appendix. Iltihab. Appendicitis. Okay? So if this is the patient of appendicitis, I think what I am doing? Tarikh al-Mar. I am taking the history only. Okay? I ask him, do you feel pain in the right lower region? It was from the start here or it was somewhere else and now come here? He says that, no doctor, before it was around the umbilicus. Okay? Now it has shifted to here. Okay? If he says that the pain was initially around the umbilicus, central region, umbilicus, and now it is shifted to the right side, I will be very confirmed that it can be due to the appendicitis. Why? Because you know the embryology of the GIT? You know? Embryology, you know? The midgut, hindgut, foregut, you know? The midgut has the same nerve supply as the umbilicus. Okay? So if some of the viscera present in the abdomen has a problem, this viscera, our viscera in the abdomen, they are painless. Abdominal, all viscera. They are supplied by autonomic nervous system. They are abdominal. They don't have pain sensation. You understand this? Yani, stomach, esophagus, whatever, duodenum, jejunum, whatever they are, viscera inside our abdomen, painless. No pain. Okay? All parts. The viscera inside our abdomen, painless. But you see here, there is pain. So this pain, what the patient feels the pain initially around the umbilicus, this is not a real pain. It is called as referred pain. You know referred pain? Yes. Yani, it is a pain here, but the thing is not here. Thing is somewhere here. Just like the pain in the heart. Okay? Never here. So, as a doctor, if somebody says, doctor, I have pain here in the heart, you say, pain of the heart. Never occurs at the heart. It is around the heart. Okay? So it means that the first thing that happens in the zaida, iltihab, is the referred pain. So the patient having pain around the umbilicus, it is a referred pain. It can be due to many. You see, midgut. Many parts develop from midgut. Many parts of the half of the duodenum, jejunum, ileum, cecum, appendix, ascending colon, okay, and half of the transverse colon. They are developed from the midgut. So all of these pains around umbilicus. You understand? So I am not sure, confused. If it is around umbilicus, it means it is a mid-gut problem. But what the patient says? Patient says that initially it was around the umbilicus, now shifted here. Now I am confirmed that here is only appendix ossicum. Okay? Why? Because I have told you that zaida is painless. Normal zaida painless. But when it is inflamed, iltihab. Okay? First of all, it has a referent vein around umbilicus, and then when the iltihab increase, it involves the parietal peritoneum. You know parietal peritoneum? Yes. Abdomen, you know abdomen? You've done abdomen? No?
Yes.
There are two coverings of the viscera. One is the covering that covers the viscera, and one is the covering that covers the inside of the abdomen. Okay? And in between this, a cavity, space called as peritoneal cavity. So this peritoneum has two parts, two coverings. One is called as the visceral peritoneum. It covers the viscera, and the other is called as parietal peritoneum. So the visceral peritoneum covers the viscera, so it has no pain. But the parietal peritoneum covers the muscles inside, it has a pain. So when the iltihab increase, masalan zaida, iltihab increase, when it involves the parietal peritoneum, the pain, because the parietal peritoneum has pain, the person feels pain, same place where the appendix is, the site of abdomen, the site of the appendix. So this pain starts from here and goes here. So it shows that this is pain from the appendicitis. Then I will ask him, do you have fever with this? He will say yes, because iltihab means there will be a fever, high grade fever. It's shivering. You know shivering? Well. Then I will ask him, do you have imsak with this? Do you have constipation associated with this pain? He will say yes, because iltihab of the zaida is a type of intestinal obstruction. Okay? Intestinal, you know obstruction?
Yes.
So due to this intestinal obstruction, there can be iltihab of the appendix. So I have asked so many questions, so I have now confirmed that, nearly confirmed that he has a acute appendicitis. Before examination, before doing nothing, now I will examine him. Does he have the appendicitis or no? Okay? If he doesn't have the appendicitis, then other things can come, masalan kidney or ovary or many things. Okay? So my examination will be focused around acute appendicitis. When I will start the examination, before the start, I will have in my mind some tashkhis, differential diagnosis. One of them is acute appendicitis. Question? No question? Okay? Now, this is my patient. Okay? To start the examination, we will do inspection. I have told you before this. Inspection, yani without touching the patient, I will see. Okay? Inspection. So first of all, I have told you inspection first you will do from the foot end, and then you will come on the right side of the patient. So first from foot end and then here, what I will do, I will put my eye at the level of the abdomen like this, and again like this. And what I will see? I will try to see some things. Masalan, shape of the abdomen. Shape. What is the contour? You know contour? The shape. Shape means contour, same. The abdomen is depressed or distended. It is big or small, inside or outside. If it is inside, it means that this person have starvation. You know starvation?
Yes.
If it is big, this can be due to many things. Okay? So first I will see this, the shape of the abdomen. Then I will see the color. Is there any bruise? You know bruising?
Yes.
Masalan, he has some accident. So, if there is some mark of the accident, it means that it cannot be due to the appendicitis. It can be something else. Masalan, accident. You know accident?
Yes.
Yes. Then I will see for the operation mark. You know operation mark? Masalan, I see. There is the operation already. He has already operated for appendicitis. You understand what I'm saying?
Yes.
I thought he has appendicitis, but when I see his abdomen, he has an operation mark. It means that the pain is not due to the appendicitis because appendicitis is already removed. It can be something else. So my diagnosis changes. Do you understand what I'm saying?
Yes.
So this is how you progress your examination. Okay? For the examination of the abdomen, we divide the abdomen into 9 parts. We divide the abdomen into 9 parts, or we can say there are 2 types of division. One type is given here. The abdomen is divided into 1, 2, 3, 4, 5, 6. Yani 1, 2, 3, 4, 5 and 6. Okay? So in the hospital it is divided into 9 parts. Understand 9 parts? Yes. And the same I will ask in the exam also, no problem. Okay? This is also correct, that is one is also correct, no problem. Okay? So, according to this picture, can you see the picture?
Yes.
According to this picture, we divide the abdomen into 6 parts. How? By 2 lines imaginary. One is like this, horizontal, around the umbilicus. And the other one is vertical, around the umbilicus. You understand? Then I will do this, like this. It will divide my abdomen into 4 parts. One is the right upper quadrant, you know quadrant? Murabba. Okay? Left upper quadrant. Okay? Right lower quadrant. Left lower quadrant. 4 parts. Understand this? And these are 4. The 5th one is just above the pubic bone, just at the level of the masana, just at the level of the urinary bladder. Yeah, pubic bone, pubis, just below the umbilicus. This part. This part is called as suprapubic region. Supra means above. Pubis is the bone. Suprapubic region. And the most important thing present here is urinary bladder. Urinary bladder. Okay? And the last part is here. Epi means above. Gastrium means stomach. So this is epigastrium. So total 6. Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant, epigastrium and suprapubic. Suprapubic. Pubis bone. Pubis bone. 4 parts and 2 sides. One is the epigastric region and suprapubic region. The place of the masana. Urinary bladder. Okay? Now, if this person, I am doing inspection, if this person has swelling in the back, in the abdomen, if this person has swelling, okay, I have to see this swelling is generalized, umumi, or localized, mahalli. Mahalli is what? Localized called what? Mahalli. Localized called what?
موضعي.
Local means local. See? I know more everything. So, listen. So, I have to see his swelling. Is it generalized or localized? Localized? If it is localized, which part? It is localized. Okay? If it is generalized, if it is generalized, then your abdomen is generalized big. You understand? Not localized. Generalized big. I will think for 4 or 5 F. F. First F, fluid. There can be fluid inside. Normally, there is no fluid inside the petrol cavity. But in some, it is a type of edema. Normally, there is no fluid present in the peritoneal cavity. But in some cases, masalan, cirrhosis of liver, masalan, liver, hepatitis, there is no present in the peritoneal cavity. We call this condition ascites. You know ascites?
Yes.
Ascites. You know ascites? Ascites. A-S-C-I-T-E-S. Ascites yani presence of
fluid.
Fluid in the abdomen. There is no. Normally there is no. Ascites. A-S-C-I-T-E-S. A-S-C-I-T-E-S. Ascites. One of the cause of ascites, hepatitis. Cirrhosis. You know cirrhosis? Liver failure.
And heart failure also. Right ventricular.
Not in the heart failure.
Right ventricular. Right ventricular.
After ventricular failure, there is failure of the liver. So the cause is basically liver failure, not the heart failure. Cirrhosis. Not that. Cirrhosis of the liver. There is different.
استسقائي.
كيف ما استسقائي
Ascites. Ascites. Listen. The liver. Function of the liver is to form albumin. You know albumin? Albumin is a protein that keeps the water of the blood inside the blood vessel. Whenever liver stops working, there is albumin production low, called as hypoalbuminemia. Okay? Whenever there is hypoalbuminemia, the power to hold the water inside the blood vessel lost. So the water come out with extravascular space. Extravascular. Okay? And when, it's a type of edema. So if this extra water, okay, edema many places, but if this edema occurs in the peritoneal cavity, it's called as ascites. Peritoneum. You know peritoneum? You have done abdomen in the anatomy or no? Huh? You have done abdomen or no? 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 You know peritoneum?
We finish.
What is called in Arabic? Peritoneum, sit there. What is the covering of the viscera?
غشاء بطني غشاء معدي
Peritoneum.
بريتانيا مثلث بريتانيا.
You know what is peritoneum or no? Yes or no? I cannot waste the time to. If I discuss the peritoneum, this will be very in the lecture. You understand? Something we should understand before.
راجع مظهر.
Okay, tell me one thing. Do you know peritoneum or no?
Yes.
You know peritoneum?
Yes.
What is this? Ask the teacher. Okay. So peritoneum. Okay. You cannot understand abdomen if you don't know the embryology of the abdomen. Okay? Basic thing, number 1. Number 2, yes, very important, because if you don't know the rotation, you know rotation of gut?
Yes.
If you don't know the rotation of gut, then you cannot understand the peritoneum. But I am not discussing this. Okay? Okay? You know rotation gut? Stomach rotation, yes. The lesser momentum, you know? Greater momentum, you know?
Yes.
How they are formed?
Yes.
For this purpose, you need to understand that. I don't want to go into this, otherwise this will be a very Tamil lecture. Yeah. It means that there is abdomen, there is peritoneum. Peritoneum is what? Is a space. In this space, there is no fluid. It's dry. You know dry? What is dry in Arabic? Okay? But in some cases, masalan, when the liver stops working, water come here. Yeah. This is called as ascites. If the person has ascites, the abdomen generally big. So, I have told you, if there is a generalized swelling, the abdomen muttafiq, بالعمومي, انتفاع. First is the F. F means fluid. Number 2, flatus, gas. Flatus. Flatus, gas. Masalan, if he has imsak, constipation, he will not be able to pass gas. So this gas will collect in the abdomen. I will show you that. See this one. See this? Fluid, ascites. Flatus, I will intestinal obstruction. Yani, if there is imsak, this swelling can be due to flatus. What is flatus? Gas. That is the gas.
Yes. Swelling, yeah.
Okay? Yani 2F. First F, fluid. Second F, flatus. Third F, fetus. In female, fetus. Masalan, the female is pregnant. So if there is pregnancy, again the abdomen will become big. Okay? So 3F. What F? Fluid, flatus, fetus. Number 4, fat. Fat. Yes. The person is fatty. Obesity. Yes. Okay? And the last is feces. Yani murras. If there is imsak, the feces, especially young children, if they have imsak, their abdomen become big because they cannot pass stool. Okay? So for the exam, this is very important. I can ask you what are the causes of generalized swelling of the abdomen. You should understand 5F. Fat, fetus, flatus, fluid, and 5. Feces. Feces. Murras. Stool. Yes. Okay, listen. These are the causes of generalized swelling of the abdomen. Do you understand this?
Yes.
Huh? Yes. Now, suppose if there is generalized swelling, khalas, I understand. It can be due to 5F.
Yes.
I will one by one I will go for this. First I will check fat, then fetus, then fluid, many things I will check. Generalized. Masalan, there is a localized swelling. If there is a localized swelling, I have to see which part is it. Is it? Yeah, which quadrant? Is it right upper quadrant or left upper quadrant or right lower quadrant or left lower quadrant? You understand this? Or can be epigastric or can be hypogastric. Suprapubic. There are two names. Yeah, suprapubic or hypogastric. No problem. Suprapubic. Understand it? Suprapubic. Okay? Now, if the swelling is in the right upper quadrant, this area, you should know that what are the important viscera present in this part of the abdomen. The most important is the liver. It can be due to the cancer of the liver. It can be due to the abscess in the liver. You know abscess? Infection of the liver. Hepatitis. Okay? In this area, there is kidney, upper part of the kidney, right kidney. Okay? So it can be due to the tumor of the kidney. Okay? It can be here there is some part of the stomach. So So it can be due to the stomach. Okay? Can be. Yeah. I am just telling you some of the points. Okay? You should understand what are the important viscera present here. So I can ask you in the exam, tell me the viscera present in the right upper quadrant. So you can write anything, but lazim you should write liver and right upper part of the right. Other you can write, no problem. But what I want is at least the important one. Yes. Now the left side. Stomach. The big thing is the stomach. And spleen. Okay, you know spleen?
Yes.
And left kidney. Not the pancreas, the back side actually. Back side, not front.
Yes.
So there is no swelling of the abdomen because of the pancreas. Because the pancreas is inside. Okay, now it is a retropetroleum. You know retropetroleum?
Yes.
Retropetroleum. Behind the petroleum.
On one side.
Yes. So if it is right lower region, lower part of the kidney,
Ascending.
and most important is this appendix. As I told you, appendix or cecum.
Ascending column.
Or not the gallbladder. Gallbladder is now. And the cecum and
Large intestine.
right ovary. Right ovary in the females. Ovary in females. Left lower part. Okay? Left ovary. Yes. Left lower kidney. Okay? And very important part here, sigmoid colon. You know sigmoid colon? The last part of the colon before rectum. First of all, go home and read the parts of the GIT.
Yes.
Now you understand. Again what? I will repeat again. Right upper, liver, and right upper part of the kidney. And more also in the jadwal, you can see the jadwal here. There are many things in this jadwal. See, there are many things. Okay? But what I want in the exam, 2, 3. Yes. No. At least 2 from all. Not all.
Yes.
Like I'm telling you now. Right upper, liver, liver, gallbladder also. Here gallbladder.
Right kidney.
Okay? And right upper part of the kidney. Right lower, most important is the findings. Lower part of the right kidney, right ovary. Cecum also. Left upper quadrant, spleen, stomach. Most important is stomach. Then spleen. Then upper part of the left kidney. Come down. Sigmoid colon most important. Lower part of the kidney, left ovary. Okay? Now suprapubic region, most important, especially in small children. Urinary bladder. Most important. Most important cause of swelling in the suprapubic region is urinary obstruction due to the stone present in the urethra. So urinary obstruction, yes, especially in the young children. Obstruction. So, and the last, the epigastric. Epigastric is only one viscera being present, stomach. Okay?
Yes.
So I have told you that if the swelling is generalized, what are the options? If the swelling is localized, what are the options? Okay? Now I am seeing this patient. I can see that his abdomen is not generally swollen. Okay? There is a localized swelling. Okay? Now I will see which part is this. Okay? So, takhayyuli, I will divide the abdomen into 4 parts. And I can see clearly that there is a swelling in the right lower part. And from the Tariq al-Mut, I figured out that this is a case of acute appendicitis. So when I see the swelling here, khalas. I am very much sure that this can be due to the appendix. Now I will, this is inspection, finish. Now I will do palpation. There are 2 types of palpation. First is called as superficial palpation, sathi. Okay? And the other is called as deep palpation. Okay? Superficial. If there is a swelling or there is a pain, okay, I will do superficial palpation. ابوالجدايل superficial palpation. In palpation, you will start from superficial. What is superficial? You will use these fingers, not this one. Don't pour. I told you before also when I was discussing the pulse.
Yes.
Don't use this. So this part you will put the abdomen. You will put the hand over the abdomen and you will press from here. Okay, like this. Okay, like this.
Yes.
So if this patient has a pain in the right lower quadrant. Okay? Huh?
Okay.
Right lower quadrant.
Okay.
I can see a swelling also. Okay? Now I want to do his palpation. Okay? So tell me, from where I will start?
From the swelling.
No, superficial, but from what region? This patient has a swelling and a pain, severe pain in the right lower quadrant. I want to do palpation. I will start from superficial. So from where I will start?
Around the swelling.
Remember, never start your palpation from the side of the problem. Never.
حتبقى
Because if there is a swelling here, if you put your hand here, you will not let you examine again. Run away because pain. You understand? Just finish your everything else, then when the last come here. Listen this?
Yes.
So if there is a problem in the right lower quadrant, you will start from the left.
Yes.
Okay? Then go up. In the last, you will come in the right lower quadrant. Okay? So what you will do, you will put your hand and with your fingers, you will press inside. Superficial, not deep, superficial. Okay? If you feel some swelling here, okay, you will try to understand this swelling is hard or soft. If it is hard, 80% chances cancer. Hard swelling, like a ball. Good. Okay? If it is a soft, you relax. Because it can be due to the small fluid abscess inside the swelling. Okay? So if you remove the abscess, okay, no problem. But if it is a rounded swelling, hard, like a stone,
Is it painful?
can be painful. But cancer, they are not painful actually. When they press something, then they become painful. By themselves, they are not painful.
Yes.
So,
It's not.
if it is hard,
It's
most likely is due to the cancer. If it is soft, yani you can see like a molar inside.
Yes.
Okay, it means it can be due to the infection. So infection can be solved, but cancer, problem. Okay, now what I had in mind about this, he has appendicitis. So I see a swelling here. When I put in the last, and I start from here, left lower quadrant, I press upper here, and when I come here, he feels pain. Okay? So in the superficial, I put here, feel pain. Pain, how? What is the pain of appendicitis? When you put, he will hold his breath. This is the quality of a true pain. Because many times patient come to you, just just leave the medical certificate. Okay? Or many ladies they come to the hospital just for the just to seek the medical attention because they don't find attention at the home, so they come to the hospital to get the attention of the doctor, just to get the attention. And for that case, you have to find out, is this patient a real patient or a fake patient or actor? So you have to differentiate between the real patient and the actor. How you will differentiate? Okay. To differentiate between real actor and true patient. Okay? There are two things. Okay? First is called as rigidity. and the other is called as guarding. I will tell you. Rigidity. R-I-G-I-D-I-T-Y. Rigidity. T-Y. R-I-G-I-D-I-T-Y. And the other is called as guarding. G-U-A-R-D-I-N-G. Guarding. What is this? That is very interesting, I'm telling you. When you will come here, you put your hand upon the abdomen. Masalan, I will put it. When I put my hand here, abdomen is the heart. I cannot put my finger inside. You understand? Abdomen is hard, not soft, not like this. Hard. Like this. Now if it is hard, how can I feel anything? You understand? Yes. So this hardness can be real and can be fake. Most of the time, the actors that come in the emergency, they make their abdomen hard. Because you cannot check, how can you reach a diagnosis? Yes. Okay? So there are two things. One is called as rigidity and one is called as guarding. Okay? You understand? So you have to find out, is this real or not real? You need to differentiate between rigidity and guarding. What you will do? When you want to examine this patient and you think that this is real or not real, and the patient is crying with pain, okay? You cannot say that this is an actor. He can be a real patient. What you will do, when you will start doing palpation, talk with him, okay? Masalan, suppose a small child or a young person, in which class do you live? Okay, where do you live? How many sisters do you have? When he will start talking to you, he will forget about the pain. Yes. This is in case of the actor. Okay, this will relax the abdomen. Okay, then you can say that. So if the abdomen, when you put your hand, is hard, and when you start talking, okay. Yeah, but there are some big actors. Even when you are talking, so there are many things. I am telling you some of the things. Masalan, tell him to take, when you put your finger inside, tell him to take inspiration. And when you are palpating, tell him that I will put my finger inside, take inspiration. Okay? So the real patient, when he does inspiration, when you're doing this, still he will have heart. But if he's the actor, you see, when you do inspiration, your abdomen automatically becomes soft. Okay? So this is number 2 thing. Yani, tell him, okay, when you do that, if he's the actor, the abdomen will become soft. And also he will not have pain. Suppose this is not very big actor. So there are all other things. Masalan, you can tell him to fold his leg. When he will fold, flexion. When he fold his leg, the muscles automatically they will relax. Okay? So all of these things they will tell you that this is a actor or a patient. But suppose he is not an actor. This is a patient. Okay? True patient. Yani the abdomen is truly rigid. Okay? So what I will do, I come here, no problem. I come here, no problem. When I come here, this part is hard. And when I put, he hold it. Okay? So I am sure that he can have some problem here. So how I will differentiate that this person has the inflammation of appendix or something else. Okay? So very easy test you can do. Okay? Very easy test you can do to confirm that this rigidity is because of the appendix.